Hi guys, this is Bhavin. So I've had around 15 messages today of dentists, associates, fellow colleagues, and they're all asking how to make the virtual practice successful. So right now there are a number of challenges that we're all facing in these volatile times, and there are lots of people out there giving advice, but a lot of our colleagues were saying, look, could you please disclose how are you doing your virtual consultations? How are you doing the workflow for your promotion events? How many cases are you starting? Because right now, there are lots of people talking about how many consultations they're doing, but in a world of Donald Trump fake news, no one's really being honest and saying how effective this is and disclosing their results. So my name is Pavi, and I only work a day and a half as an associate at a mixed practice in East London. I am described as the pioneer or the inventor of the remote Invisalign workflow, because I was doing this pre-COVID due to health problems. So I have RSI in my fingers and flexor tendonitis here. So I was a very early adapter of remote and virtual workflows, which gave me a bit of a head start. So the first thing I'm going to do is to ask you to look at my IDS account. What you're going to see is my birthday today, the 18th of November, and we've done 13,875 cases. So I'm being really upfront and saying this is what we've done. These are the number of cases waiting to be approved. So 1,500 is diamond. My goal was to always reach diamond. What we found out is pipeline sales are going to take me straight into diamond 2. So this year, our goal is to say we need to get to 200 cases. And if you told me a year ago I'd be at this point, I would not have believed it. But what we've come to understand is workflow is king. So we're now going to take apart the workflow that I am using, that the top dentists out there are using, and give this to you in bite-sized chunks. So right now I have a person who handles all the remote consultations. I do Invisalign consultations. I have a TCO who manages the clean checks. I have a therapist who does the fits, and I have dental monitoring that does everything. So today we're going to start by talking to the person who handles all the inquiries, which is this lovely lady here, Rena. You can just take your mask off for us, Rena. Thank you so much for agreeing to do this.
Hi there, I'm Rena, and I do all the virtual consultations at Dental Living.
Cool. So as a business coach, I have around 50, 60 clients right now. And one of the biggest challenges is that through social media marketing, it's really easy to find an interested person who wants Invisalign. Yeah. But to motivate them to sit in the chair is a challenge. So the first thing I would like you to talk about is these remote and Zoom consultations. So firstly, what's your background prior to working at Dental Living?
So my background is I used to work for UPS and I used to work for the Access Point team, where they used to recruit access points for parcels to be collected, speaking to drivers, doing all the admin work in the office.
So you have no experience in dentistry?
No, none at all.
So we offered you a job here.
Correct.
As technically a sales centre person to talk to people and motivate them to come in, right?
Yeah.
How have you found that process?
Initially, at first I was, to be honest, I'm a bit of a talker, and I think that helps. I think it's important to build a rapport with the client as you're talking, get to know them a little bit, and get to know what they actually want out of the treatment. Do they know anything about the treatment? So I think building a rapport is quite important.
So we went through our training where we explained the 7 KPIs of what needs to be said. We went through the PowerPoints and we had this interesting discussion.
We did.
Where you felt you needed product knowledge. And I said, what was my answer to that?
You don't need product knowledge.
And yet you kept saying, for me to have a conversation about Invisalign, I need product knowledge. And I said again,
You don't need product knowledge.
But I wasn't as nice as that, was I?
No.
Go on, say it. Stroppy, arrogant.
No. No, you said that you don't need product knowledge. It's better that you actually don't know anything about dentistry.
So you've now, in the last month, I think you've done, how many remote consultations on Zoom have you done approximately in the last 4 weeks now?
I would say,
I think around 40 from memory.
I would, yeah, probably.
10 a week, around 2 a day.
Yeah. Yeah.
So of the 40 remote consultations you've done on Zoom, how many deposits of £50 have you secured?
I would say
32.
Thank you.
So when I look at all of my clients, you outperform everyone, and all my clients have either a dentist doing it, a nurse doing it, or a dental manager who knows dentistry.
Right.
So everyone right now watching this is wondering, what does Rena know? Or how is Rena, someone who knows nothing about dentistry, able to secure £50 deposits in East London? What's your secret?
I don't have a secret. I think when you're actually making a call or when you're on Zoom, just kind of give the facts of the treatment, explain how it works, explain what it is, and like I said, building rapport with your patients. In current times, it's really hard for people to actually depart with money, and yeah, I think just...
So when I audit other people, the biggest challenge is at the end. So we spoke about the plane takes off, but you've got to land the plane without bumping and crashing, right?
Yeah.
So soft landing means you secure a deposit. You've clearly got that down. So what are your key takeaways of what needs to happen for you to successfully secure a deposit?
Again, I think just if you don't, well, I just ask them, do you want to come in for a consultation? And if yes, we need to secure the booking by taking a deposit. Obviously, with what's going on with COVID, we need to secure a booking. And yeah, they're happy to pay the deposit.
So many people watching will be saying, but we're doing the same, but we're not getting the same results. How are you building value? Because the number of problems most people are having right now is the person on the phone doesn't see the value to come in because all they want is information and pricing over the phone and then to come back to you. Whereas you're able to take it a step further and create value to come in.
Yeah, I think it's very important that they come in. Obviously, I can't actually give them the full facts over the phone and via Zoom, so they need to come in to see you, to have an X-ray and a scan.
So in other words, not knowing dentistry means you can't answer the questions.
No,
so it's easier to build value to come in.
Yes.
I think the penny's dropped for everyone. Because anyone out there who knows dentistry is talking so much dentistry, they're scaring the person off.
Yeah.
Your lack of knowledge means you have to say you need to come in, right?
Yeah, I think, yeah. And that is generally what I do say. You need to come in to talk to Dr. Bavin. And I guess that